Ulcerative colitis is an inflammatory bowel disease which causes chronic inflammation in the large intestine and the colon. Patients usually present with a history of abdominal pain, diarrhea, and rectal bleeding. With the advent of modern medical therapy, most of the time the symptoms of ulcerative colitis can be easily controlled and patient can be kept in long-term remission. There is no known cause of ulcerative colitis. Ulcerative colitis is also considered as an immunological disease, and it may be considered as a mucosal response to certain bacteria or the viruses, but till date no bacteria or virus has been associated with the etiology of ulcerative colitis. Ulcerative colitis is also considered as a genetic disease. When investigating a case of ulcerative colitis, family history is important. Usually ulcerative colitis affects men and women equally around the age of 30. Non-steroidal anti-inflammatory medication can aggravate the symptom, but they don't cause ulcerative colitis. Similarly, Accutane does not cause ulcerative colitis. Patients with ulcerative colitis usually present with a chronic diarrhea, rectal bleeding, abdominal pain, and weight loss. Severe cases of ulcerative colitis have more profuse diarrhea, dehydration, rectal bleeding. They are quite anemic. Sometimes they present with a distended colon, which we call as a toxic megacolon, and these are quite serious cases, needed immediate medical attention. Complications of ulcerative colitis include severe diarrhea causing dehydration, rectal bleeding causing anemia, sclerosing cholangitis in which the liver is affected, osteoporosis, perforation of the colon, and then there is a relatively high risk of colon cancer in patients suffering from ulcerative colitis. When we suspect ulcerative colitis in a patient, basic blood tests like a CBC, CMP, which is a metabolic panel, checking the stool for any type of infection like a parasitic infection or bacteria, doing the abdominal X-ray to looking for any possibility of perforation of the colon. CT scan of the abdomen is also important to rule out any complication like a perforation, abscess formation. The gold standard method of diagnosing a patient with ulcerative colitis is doing the colonoscopy, doing the biopsy, sending the specimen to pathologist, and getting confirmation of diagnosis. Treatment of ulcerative colitis include improving the nutritional status of the patient, taking care of the dehydration. Then there's a medication like azulfadine, which is the old medication. Now there are more refined product which include Asacol, Lialda, Colazol, Apriso, Dapentum, etc. have been used. These medications can be taken orally, or sometime enemas are used when there's the only involvement of the rectum and sigmoid part of the colon. When you're dealing with the most severe cases of ulcerative colitis who present with a massive rectal bleeding, diarrhea, and abdominal pain, corticosteroids are also used. Other immunosuppressive medication like Imuran, cyclosporin, methotrexate, and Remicade can also be used. But these type of medication are usually reserved for very severe cases. Other medication like Lomotil and Imodium can be used to reduce the frequency of diarrhea. Pain medications are also used to relieve the pain. Surgery is reserved for patients who don't respond with these type of medical therapies, and the patient who present with a toxic megacolon and they have developed perforation of the colon. Patients should be educated about their disease. There should be good communication between the office staff and the patient. Patients should be advised to eat 5 to 6 small meals per day, try to reduce the stress in their lives, breathing exercises, regular doing the exercise, listening to the music can be helpful. Increased fiber can cause sometimes the diarrhea and abdominal pain. Sometimes stewing the food, boiling it, baking it could be helpful. Try to avoid certain foods like broccoli, caffeine, alcohol, beans, acidic food. So modifying the food can be sometimes helpful for the patient.